Very much. The next question, the member for Cambridge.
Thank you, Mr. Speaker. Good morning. My question is for the Premier. Last October, the government's regulations for stages 1, 2, and 3 of the lockdown, under the general compliance sections, mandates that masks be worn for anyone over the age of 2. This regulatory policy has been in place for months now. Can the government tell us whether it has any data that proves whether mandating that children 3, 4, and 5 years of age wearing masks has resulted in a decline in COVID-19 positive reported cases?
Thank you. The Minister of Health.
Thank you very much, Speaker, and thank you to the member for the question. We know through the recommendations made by Dr. Williams, our Chief Medical Officer of Health, as well as the Preventive Measures Table, a number of public health experts have recommended that masks be worn to prevent transmission of COVID-19, and we are following. It's important, even as people receive their first dose of the vaccine, we still need to follow those public health measures to keep Ontarians safe and healthy, and that includes keeping a physical distance, wearing a mask, when indoors, wearing frequent hand washing and the other provisions, until all Ontarians who want to receive a vaccine have received both doses of those vaccines that require 2 doses. Johnson & Johnson is different and only requires 1, but the mask wearing is going to continue to be important for some months yet.
The supplementary question.
Thank you, Mr. Speaker. It appears the government has no such proof, data, or facts to support mandating children the ages of 3 or 4 to wear masks. Even the World Health Organization states in its official position, children under the ages of 5 should not be required to wear masks. This is based on the safety and overall interest of the child and their capacity to use the mask appropriately. Why, in this instance, when it comes to children under 5 years of age that wearing masks, does this government have a requirement that is crueler than what the WHO recommends? What science is the regulation based on?
Minister of Health.
Thank you. Well, these are the recommendations that we have received from Dr. Williams and all of the other public health experts who are advising us. And it is remarkable how children are adapting to wearing a mask, that they are wearing them at very young ages. It don't seem to be suffering from cruelty, as the member has suggested, but we all need to follow these public health measures to make sure that all Ontarians are safe and healthy until everyone who wants to receive a vaccine has received those 2 doses.
Thank you very much. The next question, the member for Hamilton Mountain.